For some practice owners, saying, I don't know, is about the most foreign and difficult thing to do. Turns out, at least in my opinion, it's a show of strength, not one of weakness. If you feel it shows weakness, maybe you just need some help on how to say it out loud. My guest today coaches leaders and organizations to create amazing workplace cultures, and he's going to help us learn how to say those horrible, horrible words. I'm Carl White, principal at Mark Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. That's usually what they want anyway, and care is better, in my opinion, when the provider owns the practice, because they get to make all the consequential decisions they think are best. What kind of care to deliver, even how to schedule. Do I double book, single book? Do I rush that patient out? Do I give them the time they need? All those things are in the hands of the owner, and when it's the practitioner, I just think it's better. So let's keep it simple and keep it private. My guest today is Steve Salee. Steve is with Wildfire Strategies. Steve founded Wildfire Strategies in 2008 with a vision of creating healthy workplace cultures that catch on like wildfire. Steve and his team build cultures of shared purpose, respect, and trust that dramatically improve their clients' performance. Using team and individual coaching, culture change programs, and leadership retreats, they help clients develop the structures, behaviors, and tools they need to succeed. Steve is a professional certified coach and certified mentor coach through the International Coaching Federation. He's a member of the Forbes Coaches Council, a fellow with the Institute of Coaching, and an adjunct lecturer at the Columbia University School of Social Work. He's a member of the ICF, American College of Healthcare Executives, National Association of Social Workers, and the National Gay and Lesbian Chamber of Commerce. My God, you have a lot of memberships going on. A lot of time. Steve and his family live in Westchester. Right. Steve and his family live in Westchester, New York. He sings, rows, and writes whenever he gets the chance. Steve, thanks for coming on Practice Care. With all that going on, I'm wondering if you ever get the chance to do any of those things, but thank you for carving out some time to come on.
Thank you, Carl. Yeah, I know. And as you and I were talking before we started, we both have kids around the same age. So there's
there's that.
There's all that
there's
also,
all
right?
That.
But it's exactly, it keeps
it
keeps me. Sometimes I look around when I'm in my house by myself and I just stare at the walls and I wonder why.
Right.
Because it's the only quiet moment.
Right. How long is this going to last?
Exactly.
I can relate.
Yeah.
So we're here to talk about saying these horrible words, I don't know. And we're going to get into it. It's an important topic. They're all important topics that we do. This is one of the softer ones. And I find usually they're more important, not more important, but there's a lot of value in them, because if you can turn something soft into something tangible, which I'm hoping we can chip away at, makes it a lot more doable. It's really important. Regular listeners are going to know where I'm starting, though. That was a brief bio, and we want to get to know you a bit better. So fill in some of the gaps. Help us get to know you. How'd you get into this whole coaching thing?
So it comes from having a crazy family.
Okay.
And
coaches have crazy families. Is that what it is?
No, I don't. It's like I grew up always trying to be the deep listener and the peacemaker. And I think those came naturally to me. And I think we all go pro at things we're trying to figure out in some way in life. And so I have a background in social work. I'm a social worker by training. I've done some clinical work. I have this coaching certification. I've been coaching for almost 20 years, I guess. And I've worked in consulting too. So I've done a lot of organizational assessment, and I'm looking, really to look at what's going on with people. And I have a background in public policy, so I care a lot about what goes on with people and systems and communities, right? I work a lot in healthcare with individual physicians, with groups of physicians, with hospitals. So nurses, all different kinds of leaders and all different levels in hospitals and hospital systems. So I see it from like the micro and the macro side, and really get to understand what's happening in terms of patient care, and in terms of the larger challenges that are facing individual physicians and small businesses. I also work with small businesses in other industries too. So I really I love understanding what's going on with people in their and in context. I want to understand the larger context that they're working in and living in, and how those all fit together, and how we can get unstuck from places where we get stuck, so that we can move forward.
Right, right. Context always matters.
Yeah.
That's for sure. So let's jump in, and the first place to start is, although you could find anybody in any industry, any walk of life, that you probably wouldn't have to look hard to find somebody who finds it challenging to say, yeah, I don't know the answer to that. I don't really know. Seems like it'd be harder. There's a case to be made that it's harder for those in healthcare than maybe others, maybe on the margin. You're nodding your head.
So.
Why is that?
Yeah, in healthcare, the stakes are much higher. In a law firm, and we also work in law firms, but like in a law firm, you're going to have a client that's mad at you if your brief isn't done on time.
Yeah.
In healthcare, you're going to have a dead patient, or you're going to have some other aspect of a bad outcome. That has so many ripple effects. It's financial, it's reputational. So, and the other part is in the training. Physicians are, yes, they're trained. They go through residency, and there are different aspects of training that have a group component to them, or a team, but you're really never taught how to be a member of a team. And that, I don't say that to be critical. It just is what it is, right? So in many cases,
or like a team of peers, right? Because you picture there's the doctor, there's a doctor, there's a nurse or nurses, there's people, I guess, whether they're sort of conditioned to act team-like, or whether there's more than one peer. Is that what you?
Yes. So in that relationship of the doctor and the nurse and the tech, and those, they're not necessarily functioning as a team. They can function as a team, but often they function as a hierarchy.
That's the word. Yeah.
And the hierarchy, and again, no judgment. It just it is what it is. It's a lot of one-way communication. And there's an expectation in each of those relationships, with all of those other relationships, of who the other person is supposed to be and the role they're supposed to play.
Yeah.
And the physician in this case, in this dynamic, is the person who's supposed to be the knower. They're supposed to know everything. Right? They're supposed to know what to do in terms of diagnosis. They're supposed to know what to do in terms of treatment. And the other people are facilitating and playing essential roles in delivering all of that. But the physician is supposed to be the knower. And there is also a dynamic where they're not expected to, others don't expect to be asked for input. And so they're not versed in thinking about the input they would provide.
Right.
The other thing that makes it hard for physicians, and particularly in small environments like a practice group, is that there are so many hats they have to wear. And that's hard. I mean, I own my firm. It's really hard to be
a lot of hats.
At all the things that you have to know, that you have to do in an organization. And the sooner you can say, I need help here or here or here, the better off you are.
Yeah. So I want to go back though, when you've got like a team of peers. So a doctor, you said you were starting to say, and then I cut you off, but you were starting to say that's a really difficult environment to say, I don't know. And because now there is no hierarchy right now. It's flattened. So talk about that a bit.
So in that environment, I think because, so I'll think of a hospital department, and I know, a lot of physicians who are in practice groups are also, they're also working in hospitals too. They're each expected to have all the answers for their patients, for their, and for their cases. So there's there's less cooperation and collaboration on effective care. It's still hierarchical. Even if you have a group of peers, it's a group, it's not a team. It's not, so when you think of like, a model of good teamwork, like Patrick Lencioni's 5 behaviors of a cohesive team, the base of those 5 behaviors is trust. Trusting that you can say, I don't know, I don't have the answer, or I need help here, or I think about it this way. And you have, I'm thinking about it in terms of very detailed technical issues. You might be thinking about it in terms of larger, larger issues, bigger picture issues. What's the epidemiology of this issue? So, thinking about it more broadly, let's leverage each other's strengths to support the patient or the practice, or, and that often doesn't happen.
Yeah.
Partly because that's not a set of muscles people have developed, and also probably because they're so damn busy. Right.
Yeah.
There's so much, we know that there are physician shortages, there are nurse shortages, there are different aspects of shortage in healthcare. And so they often don't have the resources that they need, and the goalposts keep changing.
What do you mean? Like, what's an example?
So, so there are increased financial pressures on practice groups, because of reimbursement rates, because of operating costs, because of the cost of resources. So there are changes in regulatory compliance all the time. So those goalposts are shifting. Other aspects of rising costs, like I mentioned the shortages. There are different ways that care is being delivered, telehealth and other ways of care at home, and so different times patients need care. There are different tiers of service, that physicians are providing as a way of responding to that.
Yeah.
So there are all these different ways that the goalposts are shifting. Not everybody is well adapted to make those kinds of shifts.
Yeah. So, I mean, you said 2 things that kind of really stuck. The ingredients include trust and time. So I have to trust you to say, I don't know. And if I say, I don't know, the follow on is, what does it take to know? Well, it takes more time and work and digging.
Right. And sometimes we don't have that time. And also because we're supposed to be the knowers, we think that the person who's supposed to know and dig is us.
Right.
So, if I'm the person who has to have the answers, then I must have to figure out how to have the answer here too.
Right.
And that isn't true.
Yeah.
There's the whole physician heal thyself, you can't be a prophet in your own land. Like, I provide organizational development services and coaching services, and I have a coach. Because I can't perform, surgery on myself.
Yeah. It's it's like the top of the world professional athletes right now, or with their coach, or will be soon, but they know everything. So it's the asking for help. I don't know. If the best of the planet are getting it, then okay. Do you see this as becoming a bigger issue or a smaller issue in healthcare? Like bigger, like it's becoming more prevalent, or just, like more gnarly, or
well, first, I love the word gnarly.
You like that word? Yeah, I can't tell you I saw it coming. It just sort of came out there.
we have a gross words dictionary in my family, and I think we need a good words dictionary, and gnarly would be
gnarly. It'll take the end spot. Yes, there you go.
Exactly. So I do think it's becoming a bigger issue.
Yeah.
Because there's so much additional complexity, and because there are more complex solutions being offered to solve problems that I think scare the hell out of people. I was at a healthcare conference in April, and most of the vendors at the conference were AI related, technologies that in some ways would be very helpful, but I think they terrify people. And I think part of the other reason why the issue is becoming more challenging is because it's still the same, your listeners are still the same physicians with the same set of skills, and the issues are getting more complex, and they don't always know where to turn. So I think that's also part of why it's getting harder, because it actually is getting more complex.
Yeah.
We are living in a more, volatile, uncertain world, and we are not necessarily availing ourselves of the help to address those things. And it's not going to be perfect by any stretch.
Right. I wonder if the root of the root cause is time, because if you don't have time, you and I can't get to know each other and build any trust. You and I, or just me or you independently, doesn't have time to track down the answer to that thing I just said I don't know about out loud. Even to figure out it's not solvable, whatever it is, whatever the resolution is, from turning I don't know into, well, here's the answer. There's no time to do it. I wonder if that's the root, just the heart of the matter. It feels overly simplistic to say it, but if you don't have time, a lot of the other things just don't seem to, they're never going to get off the starting line.
Right. I think that's true. If we don't have time, and we're not giving ourselves the space to explore what's actually happening, and there's technology. This is what I was thinking, that we have all these technologies that tell us that they're saving us time, but what they're actually doing is they're disintermediating our relationships. So, the electronic health record has its benefits, but what it does is it prevents people from actually connecting with each other, so that you can understand you understand the nuances of what's happening with the patient, and you understand the nuances of who the other practitioners are who are, who might be serving them. So you can see it on paper or on the screen.
Yeah.
So we're lulled into believing that these tools help us manage our time better, but they just actually make us more frenetic, and they burn us out more. So burnout, I mean, the research shows that burnout actually is greater because of the additional technologies we have.
It makes sense, because now you can squeeze more into a day. But I just picture, as you were saying this, I was just picturing my brain, the total amount of time I have per day to get the job done is just sliced in smaller and smaller pieces. And I'm just plinking around all over the place to this task, to that task. And now there's more that we can jam in there, because, my workspace is more efficient to get it all done. Yeah. My days that I love the most are the days when I went deep on something, and I just got in the space. The days where I just feel like I need a moment at the end of the day is when I was just ping-ponging all over, the agenda.
Right. I mean, think about how we all functioned during COVID. Yes, you could go from Zoom meeting to Zoom meeting to Zoom meeting, but you never had a break.
No.
Those moments of, that proverbial walking down the hall and exhaling and looking outside and seeing the sun and, taking a walk, like, that all matters. That all matters. Yeah.
It does. It's funny. I work from home, and everybody came home. That was the whole world. And I was relegated to the basement, I'll say office with air quotes, it's like this little hovel, no natural light. And 8 months in, I just said one day, I feel like crap, and I have no idea why. And I think it was just the utter lack of natural light for all that time.
Yes.
All that time. So yeah, I mean, just the whole thing of what you said. So I'm thinking now, this next question about, the private practice owner. So now, on top of being the practitioner, they have an organization of some number of people. And I'm wondering about the ripple effect in an organization when leaders avoid saying, I don't know. And sort of the easy part of the answer is when it's kind of obvious that they don't, or when it's just, if you're going to say that, I just wonder, like, it just seems like there's more at stake when you're running something and you say, I don't know. You better be pretty convincing, it just seems to me. I mean, I'm sort of projecting back to my corporate days, which was not, I mean, we were a business environment, we weren't like a healthcare business environment. When somebody would say, yeah, we don't know, or they wouldn't say it, rather, they would give an answer, and you're like, man, that just doesn't add up. It just doesn't, you know what I mean?
Right. So when you can't say I don't know, you're modeling lack of candor. Dishonesty is the wrong word because it sounds intentional, and it's
Yeah, I
not.
agree.
But it's you're modeling a lack of transparency, and that it's okay that means other people are supposed to have the answer when they don't. So that's one of the ripple effects. Another ripple effect is that you're not getting to the root of the issue, of the issues at hand. So if you are trying to continue to provide care with a model that doesn't work anymore for your patients, that then you're sort of running faster on the hamster wheel, or slower if they're just not coming to your office anymore. And then you're not getting at the root cause of the issue. So that's another reason why not saying I don't know is a huge issue that ripples through the office. Right?
Like you walk out of that meeting or whatever, and you think, all right, I got through that. You left a mark. You might have left a mark, and not the kind of mark you want to leave.
Right. And people know.
This is my point. It's like you hired smart people, smart enough. I mean, they're gonna,
people, they really do know. And if given the chance, they want to help. Actually, right? They actually want to make a difference. Like, people go into healthcare because they want to make a difference. Period. Right? Like, you don't become a physician or a nurse or a social worker or a PA because you just want the cash.
Right. Yeah.
And so people want to help, and that means they also want to help the business. So when you think about the challenges that the practice groups are facing, and that they're going to be facing, in terms of getting up to speed on technology and the cost of that technology, and labor shortages, and other kinds of challenges that they're just the rising costs of healthcare. So you have to be able to leverage every resource that you have at your disposal to meet those challenges. And those resources are the people in the room, some people outside of the room, and the spaciousness that you get by looking at issues in a candid and open way.
I agree.
So saying I don't know is a critical first step in doing that, so that you can begin to even explore how you might meet those challenges.
Yeah. I find it easy. I mean, I say to myself, well, I mean, I don't know most things on planet Earth. I'm one person, but it just feels like it's like a burden relief. Like, I don't know. It seems harder to fake it to me. It's just, I don't know. And then you go from there. That's me.
Right.
But I
I
guess
think that's true.
But I guess if you're right. You're trained. You got to know it. Patients crashing. I mean, that's an easy example. You better know, man. You better know what to do now. And I guess the more you know, right, the better. Yeah, I see it. I definitely see it.
I see this a lot, where when the closer you are to the most urgent care situation, a patient's crashing, there's a code, in a hospital, everybody knows what to do.
Correct.
They come together. People are really okay with being told exactly what to do and following orders and doing it, right? There's a lot of clarity there. The farther you get away from that, that urgency, the wheels start to come off. That's what is when interpersonal wheels come off. You know, in teams, I see people getting into conflict. You know, they work really well together in a code situation, and it falls apart when they're not in conflict, when they're not in urgent response. So, you know, and there are lookalikes to that in a whole host of other areas. So
yeah,
you
but
know,
it's interesting because but the mission is very clear in that moment. We can all come together for a common goal because we really, really know what it is.
Yes.
And we better act now. So your roles, this is what you know, but back to, we're not getting it today, mission and culture, they matter. If there's a common mission and a common culture, then I'll bet you would tell me that teams function better, you know, compared to when there is not.
Yeah. And there's also, I mean, a common mission and a common culture that is lived. Right. So lots of organizations, you know, have a mission to provide the best possible healthcare with the best possible customer service and at the right price and all of these things. And yes, that is how it rolls up. But the actual lived work every day requires a level of transparency, a level of trust, a level of being able to roll up your sleeves and disagree.
Right.
With one another. And that's another piece. That's the next step after saying, I don't know, is being able to say, you know, well, I think it should be this way. Well, I think it should be this way. Okay. So then let's have a conversation about this and not take it personally.
Yeah.
You know, there are a whole host of ways that teams get derailed and groups get derailed because they take things personally, or they get stuck. They're stuck in fixed ways of doing things, or in larger groups, they get factionalized.
Yeah. And just to put the point on that, so anybody who's listening who's thinking, well, we have that mission, we're good. Well, survey around, find 10, competitors. And I'll bet you if you asked them, why do you, what's your mission? They'd all say the same thing.
Yep.
But half are just killing it, and the other half are totally dysfunctional. Why do you think that is? And the answer is because of what Steve's talking about how they decide how they're going to live that mission every day, how they decide it, how they monitor it, how they course correct, all these things that we're not going to get into today. But it's the long answer to how do I change? I don't know. Well, you got to start to look at some of this.
Right. And it's also having some real sort of nuts and bolts structured activity, like developing a strategy and executing on a strategy for your business.
Yeah.
That is not, yes, there are care delivery components to that, but it's, but there are lots of other pieces to it that need to take into account who your competitors are, what's really unique about your
I wouldn't have to go far to find a doctor who's amazing at the bedside and is financially 2 days from ruin, right? So because the rest of the whole picture's got to be good.
And also to think about what's realistic, and to get a little guidance on, like, okay, what does a real viable practice look like for me? Given, my financial realities, the resources I have, the type of practice, the type of medicine we're practicing, and what we're providing, and our expertise, and all those things.
And if anywhere, listener, you're answering Steve's question, and any part of your answer says, we need transparency, we need to get to the bottom of things. I want to go to a place where we can get to the bottom of things without leaving scorched earth in the wake of doing so. Then part of it has to include, we got to be able to say, I don't know, out loud.
That's right.
We just do, just to kind of bring it back. If we can't, if I say I want that kind of culture, but I'm not willing to let that happen, save your time, because not going to happen.
Exactly. Yes. And your practice isn't going to code because or crash because you say, I don't know, but it might, and it likely will if you can't. Absolutely. Perfect punctuation mark.
Is there anything I should have asked you kind of in a wrap-up mode here? Anything we should have talked about, I should have asked you that we just didn't get to, or I didn't ask?
I mean, we covered a lot. I was talking about strategy as an example of an area that's outside of many professionals' comfort zones. Many deep subject matter experts for comfort zones. So like looking at that, looking at finance, understanding technology, get your experts who can help you with some of these things, so that you don't feel that you can both say I don't know, and you have somebody to turn to say I do, who does know, right?
Yes.
So and can help you work through a process to get to knowing.
Build an advisory team. Yes.
Yeah, I think right, exactly. Yeah, but an advisory team, get some outside experts as you need them. Not willy nilly, but like really as you truly need.
Yeah. And the other wrap-up question I ask, and maybe that's a good lead into it, is so let's say, the scenarios we've caught some listeners' attention. Let's hope we have, and there's something inside them says, yeah, that's me, or that's us.
Yeah.
And they want to change it, but they just don't know where to start. Big change, big difference. People can get enthusiastic about something, but just not know where to start. So what would you advise them? Something super simple they could do just to nudge themselves forward and get moving on this.
Yeah. Who is somebody who is outside of your practice who can be a neutral listener and help you build a strategy? I think that's one piece. And part of that is also identifying where you need professional support to do that. So it's great to turn to, a friend or a spouse or, to say, and someone who's neutral though. So probably someone who's super close isn't the best person.
Yeah.
Who can help you identify where the challenges are, but then get somebody who really has expertise in the financial planning, the really evaluating the technology, helping you put together a strategic plan that's the right size for your practice.
Yeah.
So there's I'm definitely not, I'm not a, I'm not a, hammer and everything is a nail.
Right.
Kind of person. But finding some kind of advisor, coach, strategic planner, and someone who works with you as an individual, but also with your team, who can help you to understand whether they're doing it or you're doing it together. What's the full set of assets I have here? Because there are the people who work with you probably have more to bring to the table than you're leveraging.
Yeah. And then I was thinking, if you're truly not sure, is this me? So tomorrow, when you're at work, say I don't know to something, see how it feels, and be honest with yourself. If it feels kind of icky, you got the problem.
Say exactly, and see how people respond.
See what happens. Yeah. If they faint because you never said it before, well, wait till they get back up and but see how it feels.
See how it feels. I love that. Exactly.
Cool.
Give it a shot.
Yeah.
See how it goes.
Feels. Yes.
You're not going to go into cardiac arrest. You're not,
nobody else will either.
No one else will. Right. The earth is not going to stop spinning.
Right.
And breathe.
Right. Get ready. I'm going to do it. This next 10 minutes, I'm going to do it. That's hilarious. Yes. And breathe. It's awesome.
So
Steve, this is great. This is really what I was hoping for. These, I'll say, softer skills topics that are so important and can be so pivotal. They're important to talk about. So thanks for coming on Practice Care and talking about it.
Yeah, it's my pleasure. Right. Exactly. These are the things that get in the way of all of it. Right. It's the human stuff. It makes it or breaks it. It just does.
Totally does. You provided some contact information that we will get into the show notes of this episode. So anybody who wants to go hold of you, absolutely has another way to do it. A couple of points before we wrap up. First, if you're like Steve or us, you serve private practice owners. If you're a private practice owner yourself, either way, you've got some experience or expertise on the business side of private practice. We'd love you to come on Practice Care and tell the world about it. In the show notes for Steve's episode, every episode, it's really quick and easy. There's a link, a couple of clicks. Tell us what's on your mind, and we'll get you scheduled as soon as possible. And finally, Practice Care is one word. Search for it and subscribe to it so that you can stay up to date with all the new episodes. We've got well over 100 now. More are coming. We drop one a week. If you want to stay up to date with them, subscribe, and it's all said and done. Thanks very much, and until next time.